Hello, Dr. Karthik from the Metromale clinic, urologist, andrologist, and sexologist. Thought I'll talk to you today about sperm motility and tips to improve sperm motility. Now, when you actually do a semen analysis, what you see in the report is rapidly progressive motility and then a non-progressive motility. Now, by rapidly progressive motility, we mean sperms that can actually swim like that, right? And when you talk about non-progressive sperms, you're talking about sperms that are alive, but then do not swim like this, but then go around in a circular fashion in the same place, or just wag their tails like that. So, how much is a normal sperm motility? Now, the WHO in 2010 said you need 32% of rapid progressive sperms, and then the non-progressive number should be about like 8%. So, in all, semen or the sperm motility should be about 40%. Now, I personally feel that men are overtly concerned about sperm motility because, lots of times you see them talking about my sperm motility is only about 10%. Like, how can I get it to like 30%, 40%, and like, what can I do to do this? Now, it's pretty simple. Again, just like sperm counts, it's all in like lifestyle. So same advice that I gave for like improving sperm count, like just watch your diet, reduce stress and anxiety, sleep well, eat well, lots of fruits and vegetables. When it comes to motility, what you can do is before you give a semen analysis, make sure that you would have masturbated at least about 3 or 4 days prior, because like if you do not masturbate for more than about 10 or 15 days, then the sperms get backed up and then you can have a low motility on the semen analysis. So that could be erroneous. So make sure you do masturbate at least 3 or 4 days before and then give another semen sample. Now the other things that you can do is like you avoid heat. Dry heat is dangerous. So if you're going to a gym, don't get into the sauna or the steam or all that, and avoid wearing like very tight underwear. So basically loose boxers are probably better to improve your motility. And like I said, exercise definitely helps, and you could also do antioxidants. There's one thing that I really want you to do, for countering bad sperm motility, that is to check on an ultrasound to see whether you have a varicocele or not. Now, if you have a very significant varicocele, maybe if you do have a clinical varicocele, or if your ultrasound shows stage 3 varicocele, now that is an indication for some kind of a surgical correction, because like a varicocele definitely has some effect on the sperm motility. So these are pretty simple tips, and as you keep following them, you will see that there is a definite improvement in the motility. Thank you.